Hi everyone, Dr. Arthur Plesa here, founder of Knee Chest Specific Chiropractic Certification Seminars. Today, we're going to learn all about the 5 elements of a vertebral subluxation as defined by Dr. B.J. Palmer. The first element of a subluxation is misalignment. This is where one vertebra loses its proper alignment with the segment above and or below. So what we'll see is that the articular surfaces are no longer properly lined up. With an atlas subluxation, we'll see the lateral mass converge against the occipital condyle. With an axis subluxation, we'll see convergence with C3. The objective test that we use to determine this is an X-ray. Now here's the critical question. How much does a vertebra need to misalign before it affects the spinal nerve? The second element of a subluxation is occlusion. This is where the opening where spinal nerves pass through becomes narrowed or decreased in size. In the case of an atlas or axis subluxation, we're going to find a decreased neurocanal size between occiput, atlas, axis, and C3. The objective test we use to find an occlusion is the X-ray. Now here's another critical question. How much does a vertebra need to occlude an opening before it affects the spinal nerve? The third element of a subluxation is pressure. This is where a vertebra puts pressure upon a spinal nerve. And similar to when a blood vessel has pressure upon it, both will decrease in size and their respective carrying capacity. The objective test used to determine nerve pressure is spinal thermography. This is the only test chiropractors use to differentiate between a subluxation and all the compensatory misalignments caused by that subluxation. The fourth element of a subluxation is interference. This refers to the decreased quantity flow of electric energy from the brain down to the body. Since every spinal nerve runs through the upper cervical area, a subluxation of either atlas or axis can affect the energy flow to any part of the body. Decreased energy flow causes decreased internal resistance to environmental stress factors, which in turn decreases our ability to adapt. This is what sets up the disease process. The objective test used to determine interference is spinal thermography. Chiropractors use this test to determine between a subluxation and all the compensatory misalignments caused by that subluxation. The fifth element of a subluxation is permanency. This is a 3-dimensional torqued subluxation, which is locked out of its normal alignment. This will in turn cause a neurological pattern to develop of subluxation periodicity. What we see is as the frequency of these patterns increases, so does the disease process. And what the specific chiropractic adjustment does is decrease the frequency of these patterns with the hopes of clearing them altogether, which in turn restores the healing process. The objective test used for permanency is 1, X-ray to measure the structure, and 2, spinal thermography to measure the nervous system.